Well, good afternoon, and thanks to everyone for sharing your lunch with us. I'm Susan Cosgrove, Senior Director at Health Promotion Council and the Health Promotion Services Division, and we're excited to share about the selection of services and programs provided by HPC and HPS today. Next slide, please. This slide should look familiar. Within PHMC's continuum of programs and services, we are situated within Health Promotion Services, which is the teal blue sliver sort of in the 7 o'clock position in this graphic. Next slide. The Health Promotion Council was founded in 1981 and has been a PHMC subsidiary since 1999. Our mission is to promote health, prevent and manage chronic disease, especially among vulnerable populations, through community-based outreach, education, and advocacy. And we fulfill our mission primarily through direct services and programming, training, technical assistance, and capacity building, and policy systems and environmental change. We have over 40 years of experience in southeastern Pennsylvania, and many of our programs are concentrated in this region, but we also serve communities throughout Pennsylvania and even in Delaware as well. We have a portfolio of city, state, federal grants, foundation funding, and also fee-for-service contracts across our departments. So HPC has 5 key departments, and you'll hear from a few of them today. Our Nutrition and Active Living department uses a variety of strategies to promote healthy and sustainable habits, and this includes the delivery of nutrition education classes, as well as policy, systems, and environmental change efforts. Our Department of Tobacco Prevention and Control addresses tobacco use in southeastern Pennsylvania through tobacco cessation services, youth tobacco prevention, tobacco-free policy implementation, and enforcement and merchant education around youth tobacco sale laws and point-of-sale tobacco advertising. Our Advocacy Institute is a youth training program that is designed to empower Philadelphia youth to leverage media policy and community advocacy to create sustainable change in our communities. AI works through equitable and authentic youth-adult partnerships to solve systemic public health challenges, which includes tobacco cessation, diabetes, obesity, and community violence. Our Family Services Department, which is one of the departments that you will hear from today, aims to improve maternal, child, and family health and well-being through targeted case management, home visiting, parenting education, and community-based patient navigation services that connect individuals and families with healthcare and social services to meet their needs. And then finally, under the HPC umbrella, another department you'll be hearing from a little bit later is our Training and Capacity Building Department, or TCAP. TCAP offers in-person and virtual trainings, technical assistance, curriculum development, referral pathways, and other services that strengthen organizations and communities' ability to address existing and emerging public health concerns with a focus on chronic disease prevention and management. So that's Health Promotion Council. Next slide, please. And HPC and HPS are distinct entities, but we work very closely together. So within the Health Promotion Services division of PHMC, we have 3 departments or programs. So the Workforce Development Program, another one you'll hear from this afternoon, provides job skills, training, and connections to employment. Our community investment activities encompass the $22 million rebuild project, which is focused on rebuilding Olney Rec Center into a brand new state-of-the-art facility. And then our Philadelphia Area Sexual Health Initiative, also known as PASHI, focuses on sexual, reproductive, and maternal child health with a mission to provide innovative, comprehensive, sex-positive, and anti-oppressive health education across the lifespan. And so again, HPC and HPS are distinct, but we collaborate very closely. We share some staff, and we often operate as a unit. And we're excited today to be highlighting 6 of our programs across 3 of our departments. And with that, I'm going to hand it over to Shakira Gore, the Assistant Director for Home Visiting and Healthcare Navigation, to share more about HPC's Family Services Department.
Yes, thank you, Susan. Good afternoon, everyone. Again, my name is Shakira Gore. I am the Assistant Director for our Family Services Department, and I'm here today to present 2 of our home visiting programs within the Family Services Department. So just to give you an overview of our family services, our mission is aimed to improve the maternal, child, and family health and well-being through targeted case management, home visiting, parent education, community-based patient navigation, visitation services that connects individuals and families with healthcare and social services that best meets their needs. And within our programming, first is our home visiting, which provides that care coordination, health education, supports for families and their children, including children and youth with special healthcare needs. The next would be parent education. In this sector, we offer parenting, relationship support, connection to health, and social services supports. And then we have patient navigation. In this, we enhance healthcare access and family planning. And lastly is our consortiums, which provides a network for professional and caregivers of medically complex children. Next slide, please. So the first program I'll be presenting is our TAKIP program, which is our Technology Assistance Children's Home Program. This program is a free voluntary program that provides in-home or virtual supports. It is a home-based care coordination that supports parents with children with special healthcare needs. Our team focuses on community navigators that is drawn on the shared expertise and the service areas of programming. So specifically around special education, parental advocacy, medical assistance, access and in-home nursing supports and services, and more. And what exactly TalkKIP does is provide comprehensive non-medical services to families as well as training for home health professionals to improve their capacity and expertise with working with technology assistant children. Around supports and the services that the TAKIP program provides. This is a case management and care coordination home visiting program. So we do provide home visitation services that can also be flexible with virtual supports as well. That will also include phone or video-based services. We assist families in navigating through the medical systems by also connecting them with referral basis to local community and social services supports. We also support families in transitioning into adult care with medical care support, along with a number of other services. We support families in linking to medical homes, practices, as well as providing individualized health and health literacy education. So really supporting and managing families through their educational plans and support plans for their children as well, while also assisting families address any kind of barriers or limitations. We also provide language services, and being mindful of those cultural barriers as well, and assisting them through resources. Next slide, thank you. To be eligible for the TAKIP program, this program supports families with children birth to age 22. The families will have to live in one of the eastern PA counties, as you can see in this map right down to the far left. There are 31 counties that TAKIP reaches, and Philadelphia is included as one. And also, you can contact us with further eligibility questions if you need to, figure out if a family is eligible for this program. To refer to our Talk Kit program, who can refer? My apologies. Families and or self-referrals, medical, therapeutic, community-based or social service providers, schools, school districts, intermediate units, nursing home, health agencies. So essentially anyone that is in need of supports in home, supports with a child that has a special needs, this program can surely support them. And how you can refer is by scanning the QR code, or you can email talkkip@phmc.org. And once you submit a referral, you will receive a 48 confirmation of receipt. And we also have language interpretation services available as well. And we'll take questions at the end in regards to TAKIP. Thank you. Um, So our next home visiting program is our SAFE program. This is our Safe Care Augmented for Family Empowerment. So essentially, this program is an educational, curriculum-driven program. So we provide voluntarily evidence-based home visiting services, and we work with families in their home or virtually to increase the parents' skills and helping to build a solid foundation for their children's health and well-being. And with this, we also provide navigation supports to help support the families in any kind of system navigations, medical supports, or social services supports that kind of goes along with providing the educational curriculum. Within a SAFE program, it focuses on three module areas. So the first module area would be parent-child relationship building. So in this module, providers supports families in learning appropriate positive child engagement, how to structure activities, strategies for effectively managing behaviors or recognizing those developmental stages. The second module is health. In this module, we identify symptoms of illnesses or injuries and how to respond accordingly, teaching the parents, the skills to navigating through the different health management. The last module is home safety. In this, we recognize and remove potential household hazards and reduce the potential for accidents or unintentional injuries. This program is a very highly incentivized program, so families do receive diapers during their enrollment participation. There are also grocery store cards that we provide to families during their enrollment to help address any kind of barriers that they may have with getting resources for their children or within the household itself. Next slide, please. To be eligible for this program is specifically just for Philadelphia County. We work with parents with children that are birthed to age 5 and the willingness to participate in 18 to 20 home visiting sessions. So this program can typically go up from about 4 to 6 months if a family is committed to attending weekly sessions. And again, what we do, we have trained providers that are highly skilled with working with diverse populations, including those that's impacted with domestic violence, child welfare involvement, or complex healthcare needs. So through this motivational interviewing and responsiveness to proactive instruction, our providers aim to meet the families where they are for the mutual benefit of their child's health, safety, and positive development. With our Spanish-speaking providers and language interpretation services, we also have those available to support families as well. And you can also scan the QR code to submit a referral for this program as well, or you can email us at safe@phmc.org to receive additional information regarding the SAFE program. Thank you. And next, we will have Mr. Larry Woody, which is the program manager for our Focus on Fathers team and Remix program.
Okay, can you all hear me? And have I been moved over to the right place?
Yes.
I'm good?
All
All
right.
right.
Yes.
Okay, well, hello everyone. My name is Larry Woody, and I'm program manager for the Focus on Fathers program. And I must be brief. Focus on Fathers, we help fathers develop and maintain healthy, positive involvement in their children's lives. We do that through parenting education classes primarily, and a host of services such as case management, job readiness, and father-child events and other services. Um, the parenting education classes, what we do is we provide a 13-session parenting course for fathers virtually and at locations throughout Philadelphia, some of them in substance abuse centers and that sort of thing. And we use the evidence-based 24/7 curriculum, 24/7 dad curriculum, which is used all over the country. Anyone who's fathers and father figures. Our program's open to fathers and father figures. We do that to really make it easier for men to enroll. So that includes grandfathers, uncles. If your sister's kid has needs a male to mentor or whatever to mentor them, then that person can take our class. And guys who are expecting children, they're also eligible. And now they must live in Philadelphia. They must be 18 years of age or older and have a child or caring for a child under the age of 24. Um, we we take referrals from all over the city, but I see we have DHS involved. But if they're court system involved, family court, federal criminal court, probation and parole, all are eligible for our program. And anyone who's just interested in being a better dad is eligible for our program. We're especially interested in those men. Uh, the well, let's go to the next slide. But yeah, let's go to the next one. Um, and I'm seeing here uh, direct focus on father services, voluntary participation. It's free and voluntary, but I see we have incentives of up to $150, and actually right now that amount is $200, and that's significant because that's a big deal for the men that we deal with. That incentive is a big draw. Uh, we get referrals offered in-home, in participants' neighborhood and citywide. Anyone can make a referral. We prefer that the guy who's interested in the class is the one who makes the call. That works best for us. But if you have somebody that's interested, if providers, if you have somebody that's interested, you can make a referral. But for people who are self-referred, we prefer to talk with the guy rather than his mom or his grandmom. It's just that it's a strategy for us. You can make a referral using this QR code, but you can also just go to www.focusonfathers.org. That takes you to our what is it, website page, and you just look for the link and click on it. And I'll briefly go over this ladder here. If you start down at the bottom, basically this is the process for someone who's interested in the program. There's the marketing and outreach, which is done through social media, ads, emails, events, that sort of thing. That's how guys hear about our program. They put in a referral. Basically, it says in 3 days. Generally, if they put in a referral, I'm going to get back to them in 24 hours. And once that happens, we'll send it to a facilitator who will reach out to the guy, and that will be within 48 hours. So everything can happen pretty quickly. And I'd like to mention that you usually don't have to wait more than, say, 2 weeks to get into a class. They're kind of rolling all the time. But then there's the parenting education. That's the 13 weeks. They have to complete 12 out of the 13 classes to be eligible for the incentive. The employment training, that happens somewhere during the 13-week sessions. The employment navigator generally will attend the class, be it virtual or in person, and ask, who's interested in getting a job, and then they can reach out to the employment navigator personally. And towards the end, we reassess the goals that we set in the beginning, and then discharge. And you see there it says exit survey. That's pretty important to us. We survey guys coming in, and we survey them going out. That way we get a sense of where they were when they reached us, and then where they feel they are when they're leaving. Next slide. Okay, I'm also a manager of the Remix program. That's since 2010, HBC has provided evidence-informed healthy relationships and co-parenting education services to Philadelphian parents and caregivers with DHS Parenting Collaborative funding. So Remix is funded by the DHS Parenting Collaborative. It's what we do is it's relationship education. That's what Remix stands for. Relationship education in the mix promotes positive parenting, teamwork, and conflict and anger management for those in a co-parenting relationship. And that's whether they're romantically involved or separated, living in the same house or parenting from different households. Essentially, we're just trying to help the parents be better parents, whether they're together or not. It's a 12-session parenting education class. You have to complete 10 out of the 12 classes to get a certificate of completion. And the classes are offered virtually and in person. And I'd like to say this is open to men and women, which is significant. And, either he can come, she can come, or they both can come. The curriculum is just outstanding. And we're primarily talking about co-parenting in there. what happens, what the relationship between the parents, how that impinges on the child, how that affects the child. That's really the crux of this. We don't really get into changing diapers or all that. We may talk about that, but primarily we really want to get into how the parents communicate, how they interact with one another, and get them to understand how that affects the child. We serve anyone in Philadelphia who's 16 years of age or older, jointly raising at least one child. And again, here it's like you don't have to be a biological parent. If it's a child that you're caring for, that's relying on you, that person's eligible for our program. Let's see. And to make referrals here, this is separate and apart from Focus on Fathers, which I meant before. We don't have a referral link for this, but if someone is interested, they would contact Lynn Hammond, who's the facilitator for the class, and that's her email there, or they can contact me. Either way, we'll get that referral in. And the remix objectives, again, I talk about the curriculum. It's a very strong curriculum. And I look at this chart, and lately we've been talking about, I see increased parents' knowledge of nurturing and responsive parenting, but there was increased parents' understanding of ages and stages of child development. In other words, we spend a lot of time talking to parents about how children learn and grow, and how parents can, if they focus in on that, particularly men, it makes parenting less intimidating. But it's this is it's a lot deeper than a lot of the other parenting classes, and we are the only program in the city that offers remix. And generally, we're going to get a call from DHS if they have somebody who's really interested in how to co-parent, not just parenting, but to co-parent, how to work with the other person. It's a distinction, an important distinction. But there'll be questions at the end. Anyone has any questions, please get back to me. And thank you for your time. I don't have another. Okay, good. I'm out.
All right. Well, my name is Eric Bumbaka. I'm a program manager for HPC's Training Capacity Building Department. We go by TCAP informally. Our mission is to increase access and utilization of evidence-based disease management and prevention programs. So folks who have chronic diseases such as diabetes or cancer, heart disease, we offer a variety of direct programs and indirect programming for those folks to help them manage their disease or prevent those diseases if they're able to do so. We also do a lot of work through capacity building at a local, regional, and statewide level, and influencing various systems and policies to help sustain programs throughout the Commonwealth. We'll talk a little bit about this more on the next slide, but we do have a health referral hub, which is a centralized referral navigation for anyone dealing with disease, with chronic diseases, who may want to enroll in one of our free programs. So it's a phone number, an email address. You can text, call, email, get connected, and our staff are able to screen individuals for a host of chronic diseases that they and then refer them into a program that would help them manage or prevent those chronic diseases from progressing. So it's a really great resource for anybody at PHMC to utilize to help connect any of their people in their networks, or people that you serve, to some really critical chronic disease prevention and management programming. We do direct programming for people who have diabetes, chronic pain, or other general chronic diseases. So we do run that programming in-house, and we also refer out to programs that can serve different populations, virtual, in person, and so on. One of the largest programs that we refer to is the National Diabetes Prevention Program, often shortened to DPP. These are virtual, asynchronous, or in-person programs that help people prevent type 2 diabetes. Type 2 diabetes is a preventable disease, and we really want to focus at the local community level at helping folks who are at risk of developing type 2 diabetes prevent that from occurring. It's really critical to make some, very minor lifestyle changes early on in order to prevent type 2 diabetes. And we really help run classes and support other organizations in the Philadelphia area and throughout the Commonwealth to expand these services and really help make an impact on people who are at risk for developing type 2 diabetes. We have another administrative structure called an umbrella hub organization. I'm not going to go into too much detail about this, but it's a centralized data claims and reimbursement center that allows us to bill insurance providers for the national DPP. If anybody's interested, you can reach out to some of the contact information that we'll have on the next page for more information on that. I do want to spend a little bit more time on this caring for caregivers, and you can go to the next slide. Caring for caregivers is our most recent program addition here. It's a funded program through the Sarah Ralston Foundation that is allowing us to start and expand programs for caregivers. If anybody has been in a caregiving role or knows anybody who is in a caregiving role, it takes a lot of stress and it puts a lot of impact on your body to provide caregiving for older folks or younger folks in your lives. And this program is a free opportunity for people who are caregivers to learn more about how to keep themselves healthy, because caregivers, you need to be healthy, you need to be at your best if you're going to provide care for others. And so this is a program that we're launching with the Sarah Ralston Foundation to connect caregivers to evidence-informed prevention, management, and education programs, and support the development of a peer network in which caregivers identify other resources and supports. We want to empower caregivers to be their best selves so that they can give the best possible care to the people that they care for. All of our programs, eligibility is 18 and older. We provide the vast majority of our programs are free as well. And if you have any questions at all about how to determine your eligibility or learn more about these programs, you can call or text that number 215-608-1477. We also have our email address, programinfo@phmc.org. There's a QR code there as well. So if you have any questions about caring for caregivers, our most recent program, feel free to reach out to us, and we'd be happy to connect you or any of your clients to any of our chronic disease prevention or management programs. I believe I'm going to pass it over to Workforce Development and Ms. Veronica Phillips next.
Thanks, Eric. Good afternoon, everyone. I'm Veronica Phillips, the Director of HPS's Workforce Development Programs. Our mission is to prepare individuals for family-sustaining and living wage jobs by offering job readiness and vocational training through our Together Recovery and Employment Program, as well as our Fresh Start program, which is designed to improve the circumstances of justice-involved or at-risk youth. Next slide, please. Our menu of services include a 6-month insurance and billing and coding program that prepares individuals to sit for the Certified Insurance and Coding Specialist certification through the National Center of Competency Testing. Core courses of study include medical terminology, anatomy and physiology, law and ethics, introduction to billing, ICD-10, HCPCS, pharmacology, and understanding insurance. Participants also engage in an externship while being trained in the Epic Ocean, which is a software that some healthcare entities use for scheduling, billing, and registration. Students receive 60 hours of Epic training, which is facilitated by PHMC's Healthcare Network team, and students can earn up to $900 upon successful completion. Once students have completed their core courses, Epic training, and have sat for the certification exam, they move into the final stage of programming, which is intensive job search. During this time, students are assigned a job developer who meets with them individually on a weekly basis to provide one-on-one job coaching and employment assistance with the goal of them getting connected to a job opportunity within the healthcare industry with a starting salary between $20 and $25 an hour. Eligibility requirements for this program is a high school diploma or GED, ability to pass a criminal background and child abuse clearance. Individuals must be 18 years of age or older and engaged in a recovery treatment program. We also offer a 6-week job readiness program that has 2 tracks associated with it. Track 1 focuses on professional and personal development, resume preparation, time management, conflict resolution, accepting constructive criticism, mastering the art of the handshake, and mock interviews. This customized competency-based training was created utilizing the parent curriculum that addresses 54 modules of soft skills designed for adults and high school students as we identify career goals, skill gaps, and build the confidence of individuals so they are comfortable with articulating who they are to an employer and why they are the best candidate for a job. Track 2 of the job readiness program is for individuals who are in need of immediate employment. These services include pre-screening for employability, one-on-one job coaching sessions, resume review and creation, mock interviewing, job application submission support, scheduling of interviews, and follow-up. The goals of both program tracks 1 and 2 is to connect individuals to employment opportunities based on their personal and professional background with an average starting salary of $17 an hour. Eligibility requirements for this program is 18 years of age or older and must be engaged in a recovery treatment program. Lastly, we offer a 6-week job readiness ServSafe certification training for youth that focuses on personal and social development, career awareness and exploration, life skills, financial literacy, mock interviews, resume preparation, time management, conflict resolution, and mastering the art of the handshake. This curriculum was designed by integrating Workforce Development's parent curriculum with the Pennsylvania Academic Career and Technical Training Employability Soft Skills Manual. The workshops are designed to assess and support connections to employment, vocational training, and/or post-secondary education. After completion of job readiness training, youth will also have the opportunity to prep for the ServSafe certification exam, which is facilitated by HPC's Nutrition and Active Living program. Youth will also engage in one-on-one job coaching sessions and employability services. In order to qualify for this program, youth must be between the ages of 14 and 21 and referred by juvenile probation and/or considered at risk. We have a host of employer partners that currently have immediate job openings in hospitality, call center, billing and coding, customer service, retail, food service, and manufacturing. So if you have individuals that would like to that you would like to refer to the program, next slide, you can either call or text Celestine Koger at 267-398-4323. Her email is ckoger@phmc.org. We also conduct on-site registration every Wednesday from 10 to 1 at 4601 Market Street. I'm typically there to conduct registration and pre-assessments and work to enroll individuals in our program. We have open enrollment for our job readiness programs, and we have 2 cohorts that start for our insurance billing and coding program, 2 cohorts per year. One starts in October and one starts in April. So we can now open the floor up to anybody that have questions about HPC or HPS programs that you heard today. Any questions in the chat or questions that anyone might have?
I'll just say thank you all. That was a ton of really great information. I know HPS and HPC are huge with so many programs. So thank you all for going through all of this and highlighting some of these programs that could really benefit from referrals or that could really benefit everybody else's programs and services. One of our questions that we have coming in, you cover a lot of ground. You're not wrong. Any areas you're hoping to grow?
I can jump in. Hi, everyone. I'm Ayanna Bradshaw. I'm Executive Director for Health Promotion Council and Health Promotion Services. I think that there's always room to grow because there's a need out there. And so as we think about expanding to some of the chronic diseases that we are not touching, so I think that's one area that we want to continue to grow in. We also want to continue that capacity building effort. We just received a grant to support us in piloting a community care hub, and that's an opportunity where we can connect entities to health-related social needs and really addressing those health-related social needs and providing support and resources to other community-based organizations so that they are able to get the funding that they need to address those issues. We know that we can't do all of this on our own, so there's always opportunities, I think, to think about ways that we can expand the work that we do with other entities that do similar great work and really thinking about those partnerships in that way. So one of the hopes is that we can continue to partner with PHMC programs and really think about how we expand our work and have a greater reach by using all of the strengths of PHMC along with the strengths of HPC and HPS. So thank you for that work, Jen, and continuing to do research and evaluation with your team.
We have a question about the Caring for the Caregivers program. Eric, if you want to take this one, will families outside of Philadelphia be eligible for this program?
Yeah, it's a great question. I know I believe that that you have to be caring for someone who is living in Philadelphia. So I think the person who you are caring for has to be a Philadelphia resident or living in the city of Philadelphia. I can check with my colleague Joni, who is off today, who is really administering this program. She'll have a little bit more details, but I'm pretty sure the person that the caregiver is caring for must be living in Philadelphia.
Great. And then we have one for Woody. This may be a question for you. Does father figure mean you must have a child or nephew in the area that you are caring for to participate? Or was that also a caregiver question? Maybe a similar answer.
I can answer it. You can hear me, right? Yeah, no, yeah, basically the child must be in Philadelphia. If it's a child in another city or something, I think that's where you're going. But yeah, they have to be in the city of Philadelphia.
And then can you talk a little bit more about, like, is it child or nephew or just like an important child in your life? Like, what can a father figure look like?
Oh yeah, sure. It's again, I like to say, if it's your sister's kid or just a neighborhood kid that you're a father figure to. It generally it's pretty clear if you're really involved in a child's life, and if you're involved in a child's life and you're doing some caregiving, you're spending time, that enables you to take our program. We're open to it because we can give you some suggestions on how to do that better. I'm pretty flexible. I kind of get to decide, and I'm pretty flexible on that. I want guys to be able to participate. I want men to be better fathers. And if you're spending time with a child consistently, you're a dad in my book. A caregiver at the very least.
Really great way to put it. Does anybody else have questions for this HPC team, HPS team? Somebody also asked, will the slides be sent out to participants after this? And the answer is yes. We'll send out an all-staff email with a recording of this presentation and then with the slides as well. And then just make sure that people have all the contact information, because I know this was a ton of information that we went through today. So you'll be able to follow up with people individually if you have more specific questions or if you are interested in more information about any of this. Any more questions? Well, I will be staying on just for a few minutes in case anybody has more questions. Do any of you have any like major takeaways that you wish people knew about your program when asking about referrals or asking questions about your program that you want to just end on? Oh, and we also have another one about Focus on Fathers, so hold that thought. But the website says 18 and older for Focus on Fathers. And Larry stated 16 or better.
Okay, yes, I see that. Okay, so for Focus on Fathers, it is 18 years of age or older, and that we have a 5-year grant. So right now, that's the criterion. We had 5 years before this. Then it was 16. I don't know why they raised it, but it's now 18 and over for Focus on Fathers. 16 years of age or older is for Remix, another program I oversee. So, and that makes more sense because there are people that are 16-year-old who do have kids, but they're actually with men. It's funny. We found that a lot of guys that are 16 years of age still have children. I think that's a good thing. Because some of them are doing it too early. But yeah, but for Focus on Fathers, it's 18 and older, and for Remix, it's 16 and older.
Thank you for clarifying that. And we have a question about how do you refer into the DPP program? I think, Eric, that may be a question for you.
Yeah, absolutely. So the best way to refer into the program is through programinfo@phmc.org. And I'll put that in the chat in just a second, but programinfo@phmc.org. We'll send an email to our team and we'll get connected to whoever you'd like to refer into the program. The other way is to give us a call through our call center, which is 215-608-1477. A provider does not need to refer into the program. Participants can self-refer into the program. There is some eligibility criteria to join the national DPP, and our staff is well positioned to assess the eligibility of the participant and then connect them to a diabetes prevention program, DPP, if they're eligible for that, or if they're eligible for a different kind of program, perhaps they've already been diagnosed with type 2 diabetes, we could refer them into a diabetes self-management program that helps people who have already been diagnosed with diabetes manage their chronic disease. So either way, programinfo@phmc.org or that number 215-608-1477 is the best way to connect anyone to our programs.
Great, thanks so much for that. And does the same apply to Make a Choice program also? What do referrals look like there?
Another great question. Yeah, so same process for all of our programs. Really, it's one big bucket that we get everybody into, and then we use our staff to try and assess eligibility. So that same programinfo@phmc.org. If anybody is dealing with some chronic pain, arthritis, any of these chronic diseases that folks have, we have programming for people that have chronic pain, who have arthritis, who are having trouble with mobility and moving around. So if you have any folks in that kind of spectrum of care, the programinfo@phmc.org is the best. And then referrals, what do they look like? Well, that depends. We try to refer internally as much as possible. We do have coaches that run these programs internally, so we try to keep it in-house as much as possible. But we do refer out to some of our partner organizations as well. We have partners who specifically work with a Spanish-speaking population. We have partners who work specifically with people with disabilities, with people who are blind or have low vision. So we have a really good network of internal capacity and external partners that we can refer to. So that phone number and email gives us the opportunity to assess the participant, determine what programs they're eligible for, and then we connect them to the best possible program that fits their needs, whether that's in person or virtual or otherwise.
Great, thanks for that. I think we have time for another question or two if people are interested. But thank you all so much for spending your lunch break with us. And thank you to the HPC team for all of the great work that you're doing to put this together and to help people understand it and, of course, to do it.